People everywhere, including adults with disabilities, take different medications for medical conditions like high blood pressure, asthma, chronic pain, epilepsy, and diabetes. This video sets out guidelines home share providers can follow to give medication safely so the people they support can maintain their health and well-being. Expectations that host agencies have for the way medication is given can vary. Make sure you are familiar with your host agency's medication policy and practice.
Many individuals supported in home share can have medical conditions that require them to take some form of medication. Home share providers are responsible for offering support and assistance based on each person's needs to ensure that all medications are administered as ordered by their physician. Support and assistance can range from full support, where the provider is administering the medication to the individual, through to minimal support, where the individual is taking their medication independently with some oversight from the provider. The responsibility for support and assistance with medication is one part of the home share provider's role that has the potential of risk to the individual if not done carefully. It is important for home share providers to be familiar with the protocols for administering medication and to take the steps needed to minimize potential risk. Safe storage, routine times for taking medication, having access to information on the purpose of medication and the potential side effects, along with accurate record keeping, are all key factors for ensuring a person's health and well-being. Filling prescriptions using the same pharmacy, requesting the medication to be dispensed using blister or bubble packs, and using a medication administration record are all proactive steps to avoid potential errors. Where possible, including the individual, their family members, and other members of their support network in medical appointments and discussions about medications will ensure that everyone is aware and able to assist as needed. Consulting with family members about new medications or potential medication changes can provide valuable information on the individual's medical history and previous medication interactions.
There are 7 rights that provide the foundation for giving medication safely. The right person, the right time, the right medication, the right dosage, the right route, the right documentation, the right reason. As well as the 7 rights, there are a number of best practices you should be familiar with and follow consistently. Store medication in a safe, separate location away from medications belonging to other members in the home. Don't get distracted when you prepare and give medications. Follow the prescribing doctor's directions. If you support more than one person, prepare and give medication for the right person, one person at a time. Never give a medication that is not prepared by you. Don't prepare a medication for another person to administer. Make sure the person swallows their medication before you leave them. Sometimes a person may need to take a medication known as a PRN for a specific reason, like a headache. Ensure the prescription and the reason you give the PRN match. And always follow your host agency's medication policy. This can include recording the name and dosage of the medication, when and how it was given, why you gave the PRN, and what happened. Regardless of the medication you give, you can generally avoid making a mistake by following the 7 rights and best practices. However, if you do make a mistake, you need to know how to respond so the individual doesn't face a potentially life-threatening situation.
Despite a provider's best efforts, from time to time medication errors or events can happen. It is important for home share providers to know what to do when one occurs. If there is an adverse reaction experienced by the individual, seek medical attention immediately. If there is no adverse reaction, the recommended action is to contact the local pharmacist or provincial nurse line to request advice. They will provide instructions on what to do based on the person's medical conditions and the type of medication that they are taking. Watch for any side effects and report what has happened to the agency that you contract with. Complete an internal incident report, or if medical attention was needed, complete a critical incident report and send it in right away. Contact the individual's family and support network to inform them of what has occurred. Review what contributed to the error and make adjustments to prevent a similar event from occurring again.
Occasionally, an individual will want to do some or all of the things required to manage their medication independently. As you would do with anyone who takes medication, work with the person to learn how you can help in a way that works for them. Remember, home share providers are responsible for ensuring the person follows their prescription and the medication administration record is signed. If an individual wants to manage their medication, here are some ways you can support them. Ask your host agency what they require if an individual wants to become more independent. Assist the individual to talk to their local pharmacist about their health conditions and medications. Develop a step-by-step plan with the individual and their support network. Implement and monitor the plan. Adjust the plan as required. Record progress in your monthly host agency reports. You can also use different communication strategies like pictures instead of verbal instructions if this is needed. Finally, check with the individual to ensure things are going well and they are taking their medication as prescribed. When the individual demonstrates success, you can fade your support. You can also take steps to prepare for things you think might happen. However, you also need to be ready for unusual or unexpected events because they will occur.
Challenge I had with the individual that I support was shortly after she moved in with my family and I. And we soon realized that when we tried to administer a medication, she would refuse it. And it got quite worrying because we didn't want her to miss any of her medications. So we had to come up with something pretty quickly, and strategically we decided if we placed the medication into a cup and placed it beside her meals without saying anything but monitoring it from a distance, she would take the medication and everything was fine. She didn't feel like she was being told or asked to do something she didn't want to do, and it was no problem at all.
I support an individual who's very complex, has very complex medical needs, and we're always trying to think outside the box to support this individual. We've had several challenges over the years with medications, administering and her taking medications. One time in particular was when she would spit the medications out. It definitely was a challenge. She would spit them out, and we had to try various different things to get her to take the medication. We found that applesauce doesn't work, so we would go to yogurt. If yogurt didn't work, we would go to pudding. If pudding didn't work, then we would go to something that she really liked was popcorn twist. So we would offer popcorn twist, and then she would take a medication with pudding, and then we would just go through the route of giving all of her medication. She's on a lot of medications that way. There have been times where she's spit it out and it's actually landed on the floor. We just package it up, we label it, we take it from the last place at the same time of the blister pack, and then we re-administrate it. And then we just return the unused dirty med, to the pharmacy. The outcome of the strategies that we use has been helpful because we have a lot of support and respite workers that come support the individual that we support within our home. These strategies have been useful because it works for everybody, and there's no having to think too hard about it. It's just being able to, if this doesn't work, we do this. If this doesn't work, we do this. And usually at the end of it, as long as everybody stays calm, we get the medications in, and everybody's happy.
Each person is unique. Always keep this principle in mind when you support an individual to manage their health needs and medication.
I have been diagnosed with type 2 diabetes. I take metformin. I take it every 3 times a day, morning, noon, and night. She always gets me ready for breakfast every morning. Throughout the day, she always asks me what kind of food there is, and like soups. And she does it very well, like vegetable soup and sandwiches and stuff like that, and yogurt. And she always goes to the bakery to get me some of my diabetic goodies. I used to have one of those things that you measure to take your blood, but I don't do that anymore. I don't have that because I'm good.
I have a condition called urea cycle disorder, and what it is my body can't process protein. If I have too much protein, my body can go into an ammonia shock, and I can go into hospital, or worse, I could possibly die. My home care provider helps me with taking my formula, taking my meds on time, and making sure that I take the proper foods. With the help of my home care provider, I'm feeling healthier and better.
One of the things I've observed in my role as a nurse consultant for over 30 years is that individuals with complex conditions continue to live successfully in home share settings throughout British Columbia. This is due in large part to the continuity of care that is a natural part of this environment. With the right training and supports, home share providers can give oral and topical medications, administer insulin injections, oversee bowel management protocols, follow seizure guidelines, and assist with catheterizations, tube feeding, and much more. For people with more complex care requirements, a healthcare plan and medication protocols may be needed. In some situations, nursing support for specialized training and delegation of the task to the home share provider is required. However, most oral and topical medications can be administered with information provided by a pharmacist and knowledge of best practices. While you may not be responsible for medication administration now, this can change if the person you support begins to experience changes to their health. If you notice something that doesn't seem right, report your concerns immediately to a healthcare professional and contact the person's support network and your host agency. Because medications are so important in helping people manage their health concerns and enjoy greater quality of life, home share providers need to be clear about the following responsibilities. Learn about the individual's health conditions and prescribed medications. Follow the 7 rights and best practices for safe medication administration, including safe storage and disposal. Keep good records and share information with the person's healthcare professionals and support network. Be prepared to monitor the effectiveness of the medications you give and their possible side effects, and report this to the prescribing doctor. Take steps to increase your general knowledge. And finally, ask for assistance when you are unsure about anything.
All home share providers in British Columbia can access various online resources. For example, the BC Health Guide has comprehensive information about how to recognize and manage common health problems. You can also phone 811 to speak to a registered nurse about non-emergency health concerns. As well, your host agency will have detailed information about home sharing medication policies and practices you can refer to. Thank you for watching.